Knock, knock, knock. Okay. Hi, Mrs. Smith. I'm John. I think you remember me. I was here for the birth. Okay, I'm just going to wash my hands here. How you feeling? Okay. Listen, what I'm here doing is I'm going to give you a postpartum assessment. You know, we're just going to see how you're doing and how your body is doing following the birth. Okay. Can you tell me your name and date of birth? Okay, great. Well, Ms. Smith, just to let you know before we start, this is a thorough assessment. Okay, are you comfortable with me as a male nurse examining you? I'm going to need to look at your breasts. I'm going to need to feel your breasts for any abnormal conditions. I'm going to need to feel your stomach, okay, your bowels, your uterus, and I am going to need to expose you down below your waist in your vaginal area to make sure that we're not seeing anything abnormal there. Okay, is that something you're comfortable with? Okay, great. All right. So let me put on some gloves, okay? Because I like to be extra sterile, extra clean. I don't want to, put you at risk at all. And as long as you're okay with everything, I want to document all this after we're done, okay? Just to make sure we're keeping track of your condition. All right. First of all, I'd just like to ask you, can you tell me how you're feeling? If you're feeling any pain, I'm sure you're feeling some. Okay, pain down, I know you had a C-section. Yeah, down in this area? Okay. Around your uterus? Okay, can you rate that on a scale of 0 to 10? Okay, about a 4 or a 5. Okay, does that change? It goes up and down? Okay, it just depends. And when you sit up, it hurts worse? Okay. All right, so that's fairly normal. Okay, and can you tell me the nature of that pain? Is it like a dull throbbing, or is it a sharp? Okay, it's dull and throbbing most of the time, but when you move, it's a sharp pain. Okay. All right. Well, hopefully your pain meds will start kicking in and can help with that. If it doesn't, let me know, and I can talk to the doctor, and we can maybe get that changed or get it increased for you. Okay. All right. So the next thing I want to do just a real simple, just check of your vitals. Okay. I want to look at your blood pressure, listen to your heart, your lungs, all those things. Okay? All right. I'm just going to put this cuff on your left arm. That's okay. I'm just going to put it right above your elbow here, about 2 or 3 centimeters above. Okay? And this is going to squeeze your arm, and if it starts to hurt or you feel any kind of discomfort, let me know and I'll stop. Okay? And I'll try to adjust it and make it better. Okay? Can you tell me what your blood pressure normally is? Okay. Okay, your blood pressure sounds very good. All right, you're at about 115 over 85. Okay, so that's good. That's very normal. Okay, the next thing we're going to do is check your temperature here. Okay, please stay still. Just relax. I'm not going to tell the patient this at this time, but while I'm taking the temperature, I'm also going to look for her respirations. I'm going to be counting her respirations for a full minute. Okay. Okay, good. Your temperature is 98.2. That's great. And your respirations, you're breathing about 13 breaths per minute, so that's good too. Okay, and your oxygenation is very good. You're at 98% on room air. Okay, so that's really good to see. Do you feel like you're breathing okay? Are you feeling any pain on when you take a breath on inspiration? No. Okay. All right. Well, I'm going to listen to your heart now, and then I'll listen to your lungs. Okay. So I'm listening to all 5 points. I'm listening for any murmurs, any abnormal heart sounds. I'm listening to S1 and S2. And she has a normal sinus rhythm. I'm not hearing any murmurs, any gallops, anything like that. Okay, now I'm listening to her apical heart rate. I do that for 1 minute. Okay. All right, your heart rate's very good. You're at about 73 beats per minute. Okay, so that's very normal. That's healthy. Next, I want to listen to your lung sounds. I'm listening to both lobes from side to side, top to bottom. I'm listening to the side of the lungs. And I'm listening for any crackles or rails, any kind of edema, any kind of evidence of heart failure, any kind of, any kind of fluid in the lungs, any evidence of any of that. All right, Ms. Smith, so that sounds great. I'm not hearing any abnormal lung sounds. Okay, so that's very good. All right, so next one, you need to expose your breasts like we talked about. All right, are you ready for that now? Okay, great. So now that I'm looking at your breasts, can you remind me, are you bottle feeding or are you breastfeeding? Breastfeeding, great. Okay, that's best case for you and the baby. Okay, so we're happy you're doing that. And how are you feeling any pain when the baby latches when you're feeding? Okay, a little bit of soreness. Okay, that's not too abnormal. I'm looking at your breasts and your nipples here. I'm not really seeing any ecchymosis. I'm not seeing any discharge. There's a little bit of redness, not much swelling or anything. I'm not seeing any cracking of the nipples, so that's very good. Are you feeling comfortable as you breastfeed? Okay, that's good. Just remember when you're allowing the baby to latch, that you're not having the baby just right there on the end of the nipple. Okay, and you're having the baby take the whole nipple and areola in its mouth. Okay, great. All right, now I'm going to need to feel your whole breast. Okay, and are you feeling a lot of pressure or engorgement there? No? Okay, that's good. That probably has to do with you breastfeeding, okay, keeping that pressure down. Okay, and I'm not seeing any venous distension. Okay, so that's good. The skin looks healthy. The breasts are warm. They're not cold. Okay. All right. Okay, that resumes my review of your breast there. Okay. Now I'm going to inspect your abdomen and see how your bowels are moving. Okay. Can you tell me if you've been experiencing any gas, any kind of painful bloating or anything? Okay. You're feeling a little bit of gas and distension. Okay. Have you had a bowel movement since you gave birth 12 hours ago? No bowel movement? Okay. That's very normal for a woman, giving birth either by a vaginal birth or C-section, especially with a C-section like you had. You had a lot of medicine in your body that could definitely slow your bowels down. So I really wouldn't worry about that. Okay. All right. So let's take a listen to your bowels. Okay, and I'm going to listen to all 4 quadrants just to see how it's sounding there. Okay, yeah, I can see what you're talking about. I'm not hearing a lot of vowel sounds, but I am hearing some. So that's what we call hypoactive. But I would let's keep an eye on it, and your bowels should kind of regain their motility here in the next couple days or so. So let's just keep us posted on how your bowels are doing. Okay. So I'm going to look at next. I'm going to look at your incision over your C-section. Okay, and once again I have my gloves on, so it looks like it's healing well. I'm not seeing any edema, right? Any swelling is what we call that. I'm not seeing any blood. I'm not seeing any redness. No signs of infection. Okay, I'm not really. There's a little bit of drainage, but that's some normal serous drainage. Okay, that will eventually go away as you start to heal more. Okay, and the approximation is very good too. Okay, so your incision looks very good. So what I'm going to need to do next, I'm going to need to feel your uterus. Okay, I'm going to need to massage it a little bit, and there's going to be maybe some discomfort, some pressure. Okay, but that's normal. The reason I need to touch and massage that uterus is to get that uterus contracting and to reduce hemorrhage and bleeding, okay? All right, so deep breath. Okay. So it looks like your uterus is about 2 centimeters below your belly button, what we call the umbilicus, okay? So that's very good, and it is midline, all right? So that's where we need it to be. And with a little bit of massaging, it was a little bit boggy at first, but it feels like it's firming up, okay? So that's very good. Okay, you feeling a lot of pain there? I'm sorry, I know that's very uncomfortable, but it has to be done. We just don't want you to bleed a lot, okay? This helps to stop some of that bleeding. Okay? All right. So it looks like you're right where you need to be, okay, for 12 hours postpartum, okay, right after your birth, okay? How is your bladder, your urination and everything? You say you're urinating a lot? Okay, that's normal too, okay, because you've been you've been given a lot of fluids and everything. So just like I talked about your hematocrit and everything, about your fluids, that's very normal. So we're expecting you to pee a lot. So it's good that you're getting a lot of that, flushing a lot of that out. Does it hurt at all when you urinate? Good. Okay. We're glad that doesn't hurt. Okay. Now, this is where I need to expose you down below your waist, okay, to take a look at kind of, your discharge and everything coming out of your vagina now that you've given birth, okay? Can I go and expose you? Okay, great. Okay, it does look like you're having a good amount of discharge, and there's, there's some afterbirth in there. It's very red. That's what we call rubra. That's very normal. We want to see a lot of that discharge, 12 hours after the birth. When did you last have a pad? Okay, about 3 hours ago. Okay, so that's pretty good. That's normal. If you start to soak through a pad faster, than like 1 every hour or faster than that, then that's a little more abnormal. Okay, so let us know if that starts to happen. Okay, everything else is in really good condition. That's one of the benefits of having a C-section. You're not having you didn't really have an episiotomy or anything like that. Okay, so I'm glad to see that. Okay, so next thing I want to do, I want to look at your legs. Okay, because we're worried about make sure that you have like really good blood flow and perfusion through your legs. Okay, so I'm looking at both your legs, and they're both symmetrical. If one were more swollen than the other, then that might be a sign of having a thrombus in there, having a DVT. Neither one are. I'm not really seeing any edema. I mean, your legs may be a little swollen because of all that fluid, but I'm really not seeing anything abnormal, so that's good. The last thing I want to do, I'm going to push up on your foot, and I'm going to look for the Homan sign. Okay, when I push up on your left foot, are you feeling any pain behind your knee, on the back of your leg? No? And the right foot? No? That's great. That's what we want to see. No pain. So it sounds like you're having very good blood flow down there. Okay? Next question is a little bit personal, but we have to ask. It's a very common condition. Are you feeling any itching in your rectum that might be indicative of hemorrhoids or anything like that? Okay, you are, and you've had a history of hemorrhoids? Okay, no problem. We'll get maybe some hemorrhoid cream, all right? And if it gets very severe, we'll have your doctor take a look at it and assess from that point. Okay, so I'll be right on that and take care of that because I know that can be very uncomfortable. Okay, all right. So, Ms. Smith, the last conversation we need to have is about your emotions. Okay. Have you had a baby? You haven't had a baby before. That's right. Okay. So it's going to be very normal for you for the week to 2 weeks after you've given birth to have something what we call the baby blues. Okay, that you're going to feel a little down. Your hormones are not going to quite be stabilized. Make sure your husband's aware of that. And you're going to feel a little bit down. You're very tired. There's a lot of anxiety. Can I take care of this new baby? This little baby's depending on me. That is totally normal, okay? So Breastfeeding should help a little bit with that. But after 2 weeks, if you start to feel majorly depressed, like you just seem like you can't get out of those baby blues and it's getting worse, if you have thoughts, and this happens sometimes, of hurting the baby or hurting yourself, that's very serious, okay? And you need to come in and see us, and we're not going to judge you, we're going to get you help, okay? You can call us, you can call a helpline, but you do need to come and see the doctor if that happens, okay? So do you have any other questions for me? Okay, great. I'll be back in. I want to talk to the doctor. I want to get you that cream to help with your itchiness. And if you need anything else, just let me know, okay? Wash my hands. Okay, thank you, Mrs. Smith.